this computer. All right, hello everyone. Welcome to tonight's group session. My name is Andrea Farmer and I'm a nurse practitioner. And tonight I'm here to guide you through actually a scientifically backed cognitive behavioral therapy technique that has been proven to reduce anxiety and quite quickly. As this group is intended for those with social anxiety, we're going to work on a few specific cognitive behavior therapy techniques that you can combine. We're going to practice this technique together tonight, and it's one that you can implement into your daily life and practice at any time, in any location, and whenever it's needed. The scientific evidence and research does support this technique, and it has been used to treat and reduce symptoms specifically associated with social anxiety. So to start, let's first define what social anxiety is. According to the DSM-5, it is a marked level of fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. Social situations tend to be avoided or endured with intense fear and anxiety. Symptoms have been present for greater than 6 months. And the fear and anxiety will promote avoidance and thus impair social, occupational, and other important areas of daily functioning. In addition to present symptoms, they're not always attributed to another medical condition, and social situations almost always provoke this level of fear and anxiety. So I imagine with everyone here tonight who has social anxiety that it was somewhat difficult to come to this meeting. And knowing that you're working towards coping more effectively with your present social anxiety symptoms, especially in a group setting, I want to recognize you in this moment and congratulate you for being here. So let's get started. While there are many techniques to use to reduce symptoms of social anxiety, breath work has actually been shown to be one of the most effective. And specifically tonight, we're going to learn how to perform diaphragmatic breathing. This is also known as deep breathing. Any questions?
Wait. So we're going to just sit here and breathe? I do that all the time. That's never worked in the past for me before. I just don't know how to breathe when I have panic anxiety.
Yeah, I know. I understand breathing is sounds somewhat simple, but if it's not done well, it's not going to be as effective. So the goal for you is to recognize these early symptoms of anxiety, perhaps when you're anticipating a social event, and understand that you're likely going to become anxious. So I want you to notice early on feelings of anxiousness, what this looks like, and when it is best to deploy your parachute, so to speak, and slow that fight or flight response that you can feel. You may notice symptoms of sweaty palms, racing heart or thoughts, difficulty forming your thoughts, or numbness and tingling throughout your hands or other areas of your body. Does that make sense?
I mean, it makes sense. I just don't really think this is going to work for me. I'll give it a try, but I'm not convinced.
Okay. Well, thank you for being willing to practice this with myself and the group. Are there any other questions? Okay. So I want everyone to focus now in this moment. And remember, we need to be in the here and now mindset. So if you feel comfortable, go ahead and sit back in your chair and close your eyes. Or you can stare off to the side and just kind of look off into the distance. Now, I want you just to notice your breath. Feel how the air moves slowly in and out. The rise and extension of your belly as you inhale, and the reduction of your abdomen into your body as you exhale very slowly out. So as you had mentioned, you don't think this is going to work. The pace of which you're breathing is going to be important. So very slow exhales as you do this. So when you breathe in, I want you to breathe in deeply through your nose, feeling the air fill the lowest part of your lungs. Breathe in nice and deep, and take a big breath in again and hold. Wait a few minutes here and blow out through your mouth. Blowing all the air out of your lungs very slowly. You want to exhale very slowly here. So as you sit, take a moment to notice your feet on the floor. If not flat, make them flat now. Notice the tension in your toes and your feet. We're going to take another big deep breath in together. Take a big breath in and hold for a few moments, filling your lungs as much as possible, filling them with air until no more air can fit in, and blow out nice and gently. There you go. Good job. And as you take these deep breaths in and out, feel the muscle tension throughout your legs, into your hips and abdomen. I want you to take another big deep breath in and hold, filling your lungs with as much air as possible, and inhale slowly out through your nose. And as you exhale out, very slowly through your mouth. Notice the muscle tension in your fingers and how they might be gripping a surface or resting your palms and wrists up to your arms. Just being aware of the here and now of what your body is doing as you sit in this chair, taking big deep breaths in and out. I want you to keep breathing, so let's do this again. Take a big deep breath in, and as you breathe in, feel the tension in your shoulders and your neck, and blow out, feeling the tension relieve through your breath. Maybe your neck is a little tight. You can move it around in all directions, stretching from side to side, noticing your breath. Let's take another big deep breath in and hold, and exhale very slowly out. I want you to take notice of your heart rate. See if you can feel or hear your heartbeat. Notice the pace at which your heart is beating. I want you to take another big deep breath in and hold and blow out, noticing your heartbeat. As you exhale out very slowly, I want you to notice if your heartbeat changed at all. Perhaps it's a little bit more slow. Slow, deep breathing exercises helps to increase the vagal tone, which can trigger that parasympathetic response through the vagus nerve. This deep breathing in the vagal tone does affect the vagus nerve, and this causes a natural change in the physiologic stress response. So you can train your body how to create this calming response through deep breaths, noticing muscle tension, and working from your feet up to your head and neck. How does everyone feel?
I do feel a little bit more relaxed. I'm not quite sure how I'll be able to do it when I'm panicked, though.
Yeah, that's a good question. So I want you to note over this next week, perhaps in a journal, what is causing your anxiety. I want you to become more aware of moments that you are in and being thoughtful about how you are feeling in a particular moment. Start noting maybe what feels anxious to you, and it will be helpful for you to recognize these triggers earlier on so you can start doing some deep breathing. It's an art, it's a skill, and it's going to take time to develop. And so practice is going to help you become better at it. So when you start feeling these symptoms, I want you just to start taking a very simple, big, deep breath with your feet flat on the floor and just kind of remove yourself from the situation, if you will, with your breath.
Okay, I'll give it a try this week. It seems simple enough.
Okay, I appreciate your efforts. And does anyone else have any other questions? Okay, thank you everyone for participating. I hope you have a nice week. Please bring your notes to next week's session, and maybe we can share some of our triggers and work through those deep breathing exercises again. Thank you.